Welcome into Eye on Northeast Kansas, the podcast. I'm your host, Melissa Bruner. This is where we recap the week that you might have seen on air on Eye on Northeast Kansas, the TV show. It comes to you Monday through Friday, 4 o'clock Central Time from our WIBW studios in Topeka, Kansas, and you can always catch it streaming on WIBW.com. This week, we take time to launch a very special project for us at WIBW-TV. We're calling it Hear Me, See Me. This is a concentrated effort to raise awareness for issues surrounding mental health. We're going to raise awareness, help erase stigma, connect people with resources, and perhaps inspire change along the way. The project kicked off this week with a special panel discussion during our Eye on Northeast Kansas show. You can catch all of these episodes and, of course, find resources anytime on WIBW.com/Hear Me, See Me. But first, we bring you Hear Me, See Me. Good afternoon and welcome to a special edition of Eye on Northeast Kansas. We are launching a special campaign here at WIBW-TV called Hear Me, See Me. All this year, we'll be shining a spotlight on mental health, raising awareness, erasing stigma, connecting you with resources, and inspiring change along the way too. We start right now with an overview of what mental health is and how communities are working to address it. Please know as we go through this discussion, if you or someone you know is in crisis, you can reach the National Suicide Prevention Lifeline at 988. What do we mean when we say mental health? That's where we're starting today. Dr. Laura Seidlinger is Director of Medical Services at Vallejo Behavioral Health in Topeka. Jenna Dunham is Director of Medical Services at Pawnee Mental Health in Manhattan. And Amanda Cunningham is CEO of Crosswinds Counseling and Wellness in Emporia. So glad you all could be with us. And I'm so glad that we have our region represented here today. It's so important because, Dr. Seidlinger, it is a broad definition when we say mental health. What are we talking about?
So I'm gonna take it from the other angle because we talk about mental health disorders. They can be behavioral or psychological changes that then can impact other areas of our lives, our work, our school, our relationships, our peers, and it can be something that can be just very minor. Some anxiety, which is a normal emotion, but it helps. It keeps us in check, but it can get out of hand and keep us from doing things that we should be doing. Or it can progress into more serious mental illnesses, such as the severe persistent mental illnesses like bipolar disorder and schizophrenia, as well as other psychotic disorders.
How do you, Jenna, weigh out one versus the other? So those that, and we don't want to say those that don't necessarily affect your life, because that's the point. They all are going to affect your life. But those that are the severe persistent mental illness versus those that maybe people think of as something that we could perhaps more easily cope with in our life?
Yeah, that's a great question. And I think a lot of it is about balance, and it's also about not operating in a silo and being able to normalize a lot of what we experience as mental health, because honestly, mental health will touch you, me, and everyone that we know in one fashion or another. And so understanding when it's okay to reach out, when it's good to get connected to resources, maybe the answer is we always should be connected in those networks in some fashion or another.
For you all in Emporia, Amanda, is there any specific challenge you see in being able to make these resources available for people across the spectrum?
I think that's a really broad question.
Right.
I think that there are lots of barriers that we have run into over the years that we are slowly trying to get rid of and have better access and address some of those things differently. So traditionally we might have scheduled an intake or a new service and it'd take you 7 to 10 days to get in, and then another month to 2 months to 3 months to get medication and things like that. Yeah. Now we have open access. You can come in same day and get those services and then get into medications in 1 to 3 days. And so just streamlining everything and making sure that there are no unnecessary barriers for people to get in and get those services started.
Let's hit on that severe persistent mental illness, because we're probably going to talk about the others a little bit more frequently as we go through this discussion. What do we talk about? What are those diagnoses that we mean when we talk about the severe persistent mental illness?
The two that I think I treat the most would be the persons who have schizophrenia or psychotic disorders. They may range from some benign delusions that really don't impact their lives, or it can be other things that become almost like phobic fears, feeling like they may have devices implanted in themselves, or they can hear the TV communicating with them, and that can be very, very distressing. Oftentimes you will see people who may respond to unseen others, or they may feel like something's touching them that's not there. And so, and the bipolar disorder is more of I describe it more as an emotional roller coaster, because people can be very high and then very low, or very irritable and then very low. And just finding that balance and getting somebody off that emotional roller coaster, getting those moods regulated towards the middle where normal people live.
Right. What is normal?
Now, there is no such thing
Right.
as normal. And I guess that's one of the points, is that we don't look at any mental illness, no matter the severity, as any different than we look at medical issues like high blood pressure, diabetes, even like cancer.
When we hear these diagnoses, Jenna, can people with those types of severe persistent mental illness live in the community?
Yes, absolutely they can. And we are here to help get them the resources and the supports that they need for them to be able to do that successfully. I think one of the biggest barriers that we experience is in the practices that I'm in now is social determinants of health is a huge barrier. And that can impact someone's life. If you can imagine having difficulty with finances, with transportation, and those kind of things, and then also having to deal with mental health being a barrier for you as well, it can make it exceedingly difficult to access things that you might need and services that you might need.
And when you're in an area like you are, Amanda, because you serve a wide swath around Emporia, which is very rural, when you're in an area like that, what are the barriers you encounter as well?
Well, they're about the same. They just look a little different. So the transportation, stigma related to even going in for mental health services, could be cost and the socioeconomic status. All those things kind of play into that. And so what you're seeing in the big cities, might be a 10-mile stretch. Now we're talking 55-mile stretch of how do we get to individuals when they're in need, and how do we get them into our offices or whatever that is that they're seeking.
A lot of questions, and all of you are working to find answers. And of course, with such a wide range of people needing a wide range of help, how are communities working to meet all those needs? We'll take a closer look next. With mental health covering such a broad spectrum, communities are tasked with meeting a broad range of needs. Bryn Haverkamp is Crisis Director at Pawnee Mental Health, Lucas Moody, Development Director at Crosswinds, and Brad Chapin is with us, Director of Clinical Services at Stormont Vail Behavioral Health in Topeka. Welcome to all of you. So you are focused on the Manhattan area. What have you found is the need and demand around the Little Apple?
I would say a lot of it, as they mentioned before, is that transportation need. We're focusing on a lot of mobile crisis support, where we're responding to some of our more rural communities without the support of our emergency responders. And I think that is going to meet a lot of needs that we haven't been able to meet before.
And how wide of a range of area do you serve?
Pawnee Mental Health covers 10 counties,
Wow.
anywhere from Raleigh County to Mitchell and Jewell County are more rural areas.
And those rural areas are such a concern. Lucas, how broad of an area does Crosswinds serve?
So we cover 7 counties. Most of them are rural. One of our counties is actually a frontier county. And with our counties, it's the same thing. The communication, getting the voice and the word of what our services are out to everybody can be difficult. Getting the transportation to get back and forth to services has been a big barrier for us. Telehealth has changed a lot in that world, and so that helps give access a little deeper and more penetrating into those counties.
What do you mean by frontier county?
So Frontier County is a county that our population density is much different than even just a regular rural county. So population per capita in that county is much smaller.
Brad, you're in Topeka, so you're in an urban community. What are the needs that you see that maybe might be a little bit different, and what are the similarities in terms of challenges that we face even in an urban community?
Yeah, fortunate in Topeka, but we are part of a large healthcare system. Stormont Vail covers several counties, so we're also trying to reach out into the rural, also with a large new clinic in Manhattan. But some of the rural challenges, still transportation, if you can believe it or not, is an issue. Homelessness. There are a lot more supports here in Topeka, but I think education. I'm really glad you're doing this segment. I've seen a lot on mental health literacy coming out lately, so I think you're right on trend with doing this, getting people the basic information about how to access services, where to go, when they need to ask for help, and just getting that basic information out to people that need it.
For all three of you, why should this be a community focus? If this is not available in your communities, what's the consequence, Bryn?
The consequences is it's more extreme of a cost to our communities. You talk about first responders, law enforcement, EMS, your local ER. If we don't have the services in place, we are inundating those other services, and then they're not available when they need actual emergency services. So finding the appropriate response for mental health clears that out for the rest of those agencies.
How about for you, Lucas?
Yeah, I always tell them that, my big thing is I want people to be happy, healthy, and safe. And when we find people are happy, healthy, and safe by the resources that we can provide and support them in the manner that they need supported, our communities become happy, healthier, and safer. And so together, all of that stuff kind of makes that perfect picture. These resources are vital to that.
For you, Brad?
Yeah, I think telehealth was a big piece of it. So that's something that we can provide and reach out to folks that may have a lack of clinicians in their area. We've been doing about 30% of our outpatient visits still have been telehealth, even after COVID has subsided a little bit. So that gives us a chance to reach out to somebody that can't leave the farm to drive to Topeka to go to an appointment. They don't have to leave. Or on days like we had sub-zero temperatures, you can stay home and still receive your visits. So just taking advantage of the technology we've been given.
Are you saying that a mental health crisis doesn't watch the thermometer? I mean, and that's serious. I mean, you have to be able to access it when you need it and not wait for the weather to get better.
Exactly, yes. And to have that option, it's been wonderful to reschedule appointments on days like that. Has been great for patients.
Well, access is a big issue. I thank all of you for giving us a little bit of insight into what you're doing to try and overcome some of those access challenges. Thank you so much. Well, meeting needs means focusing on all ages. We will examine when that brings special considerations for children and teens next. When we talk about physical health, we are often reminded that children are not just tiny adults. Their needs are very different. Well, the same is true for their mental health. Karen Smothers is Clinical Operations Director at Family Service and Guidance Center in Topeka. Dr. George Thompson is a child psychiatrist. He's also a board member for NAMI Kansas, a very important organization when we talk about resources. Thank you both for being here. And right, Karen, kids aren't just tiny adults. How does that hold true for their mental health needs?
Oh, absolutely. So yeah, children are developing and growing and rehearsing all of these things that we're modeling for them as adults. So children really need nurturing environment. They need to be fostered and stimulated to grow and develop and learn social skills and how to cope, resiliency, and kind of emotional health as well.
Dr. Thompson, I think a common phrase we use with kids is, well, they're just going through a phase. How do we know when something is a phase and when something truly is a mental health crisis?
One of the things that we look for is how are they functioning? How are they doing at home with their family? How are they doing at school? How are they doing in the community? If they're no longer able to function, then we call that a mental health disorder.
Do kids actually have the same sorts of mental health disorders as an adult? How young is too young to be diagnosed with a mental illness?
So 50% of mental health disorders in adults appear before the age of 14. So a lot of times it's starting in childhood. But there are other disorders like attention deficit hyperactivity disorder that affect more children, and some people grow out of it when they get to be adults.
Can kids have bipolar disorder as well? Something like that, the severely persistent mental illness?
Yes, they can, but it's more rare to have it as a child. And if a child has something like bipolar disorder, schizophrenia, then it's a sign that it's going to be a more severe situation.
What are the challenges, Karen, that you see when it comes to meeting the demand that there is for these services and also for parents being willing to access these services for their kids? I think we've heard a lot about just bed space challenges for kids who maybe perhaps need some inpatient treatment.
I would say, yeah, there's a huge demand right now for services, which I applaud. The pendulum has swung, I think, from avoiding talking about mental health services to let's bring this out in the open, just mental health in general, which is welcomed. So I think people and families that we see are much more cognizant of emotional and mental health development, cognitive development, social skills. We're seeing a lot more since the pandemic as well, where I think that became quite front and center for families in terms of trying to get help, seeing this more personally instead of just at school, kind of experiencing it at home. And so, yes, there's community mental health centers that are available. People are accessing telehealth. People are reaching out. There's a lot of people reaching out for help, whether it be formal or informal services, psychoeducation, or support.
For children, Dr. Thompson, are there still as many people going into the child mental health specialties, or are we talking there are places in Kansas that parents might be driving hours to get help for their child?
You're right. There are places where it's very hard to access services for children, especially for child psychiatry. So a child psychiatrist can prescribe medication, a nurse practitioner can, but a lot of medications for children are prescribed by family medicine doctors and pediatricians.
So what does that mean when it comes to getting a prescription for mental health? If all you have in your county is a general practitioner, what happens?
So usually what happens is they do the best they can, and with things that are more common routine, they do a very good job, and then they have to refer for other things that get to be more complicated.
And that's where the distance comes into play. But let's leave people with some hope here. Can mental illness in children be helped to have them go on to be happy, healthy adults?
Absolutely. In most cases, children and adults recover from what is a temporary or episodic mental health symptom or problem. So we see a lot of success especially with early intervention. The earlier we get people help, the better long-term outcomes they have.
And that's why you're here spreading the word. Thank you to both of you. Appreciate it. So if you are seeing yourself or a loved one in any of what you've been hearing today, help is available. We'll take a look at how to get connected with resources next. Even with the challenges in addressing mental health, everyone here today wants you to know help is available. So how do you find those resources? Isaac Johnson is the NAMI Kansas Resource Director. Bill Persinger is CEO of Vallejo Behavioral Health. Thanks to both of you for joining us as well. So I guess the broad question is, how do you get connected with resources? Isaac, that's what you do.
That's what I do, yeah. It is a simple question, but also a big question. So it's just about who do you call? Well, I'm one of the first lines you can call. So I work for NAMI Kansas. We're a nonprofit that does mental health stuff. If you call our resource line, so that's my phone number, and I'm going to say it out loud, 785-244-4496. If you give me a call, I call myself a broker. I can basically say, these people might be able to help you with the specific problem you need. It can be finding a therapist. It can be, I'm having trouble paying off my utilities. It can be, I'm having trouble with transportation, how do I get telehealth, that sort of thing. I can answer a lot of questions and get you connected with people who can get you the help you need.
You truly are the clearinghouse. And when it comes to NAMI, what area do you serve?
Everywhere. NAMI Kansas is statewide. So, our office is in Topeka, but we have affiliates all across the state. We have about half the counties covered. We're still expanding our services and where we're at, but even if we don't cover your county specifically, we can still help you. You can still give me a call and I can still do my best to get you connected with people who are going to help.
And Bill, for Vallejo, located in Topeka, what is the breadth of services that you offer for those who aren't familiar?
Well, we're blessed really all across the state of Kansas with, access to public and private mental health and, from east to west and north to south. But here in Topeka, we're very fortunate to have our Stormont Vale West, our behavioral health partners for inpatient care. Breakthrough House offers a consumer-run alternative, and a family service and guidance center there, for children and adults. And Vallejo has a wide spectrum of specialty services for adults with mental illness, mental health problems, alcohol and drug abuse, alcohol and drug addiction. And so, I really think that, no matter where you look, help is going to be available. We rely heavily on first responders, family physicians, one's pastor, family and friends to, know where the resources are. Good old search on a computer under, mental health counseling or mental health intervention, crisis intervention. Would be a great way to search locally if you don't know where else to go.
You mentioned crisis because I don't think everyone is aware that in Topeka, Vallejo does have a 24/7 walk-in crisis center.
We do.
Nobody has to bring you there.
No, that's right. That's right. It's a voluntary place you can go and get a screening or an evaluation to find out what your needs are. If a person's pretty far down emotionally and having a hard time, they can stay with us for 2 or 3 days and we'll get some treatment going. And it's all voluntary, all at the person's own free will. Right down the street, 24 access at Stormont Vale West for psychiatric care. Detox services are available 24 hours a day at Vallejo. And of course, our emergency room partners at both hospitals are great at making an assessment and calling up. So, almost everywhere you turn, I think what our objective has been is somebody would bump into information about how to get care, if you don't actually bump into one of our staff out there on the street
But
in your home.
here's the other piece of the puzzle for both of you. How do you get care if you don't have the financial resources? What is out there? And let's start with you, Isaac. If you don't have financial resources, can you still get help like this?
Well, yeah, NAMI Kansas, one of the big benefits we have is that we provide free support groups and educational resources for both people with mental health conditions and also their loved ones. So that includes family members, spouses, partners, friends. And again, everything is free, and a lot of it's also available through telehealth. Or it's not telehealth, but online through Zoom.
Right.
It's that following that COVID.
And how important is that to have the family and friend resources?
Oh, it's so important. I have so many people, I'll be out tabling somewhere and someone will walk up to me and say, NAMI saved my life like a decade ago.
And for you, Bill, if people don't have financial resources, what do they do?
We're blessed with public funding for mental health at Family Service and Guidance Center, at Breakthrough House, and at Vallejo. So thank you, taxpayers. Everybody chips in so that an individual can seek public mental health and public addiction treatment services from zero income clear on up the economic scale. So we don't discriminate against how much money you make or don't, who you are, how old you are, the severity of your problem. Anybody can walk in the door anytime and get help.
And we have heard
access.
today why that
You have.
public investment is so important
It is.
overall to everybody. Isaac, Bill, thank you.
Thank
to
you.
leave you with some of those resources, again, if you are in crisis, if you need someone to talk to, the National Suicide Prevention Lifeline is 988. NAMI Kansas, if you want to reach Isaac and didn't catch his phone number, you can go online to NAMI-NAMIKansas.org. And we have contact information for everyone that you have seen here today, all of the organizations represented, Pawnee Mental Health in Manhattan, Crosswinds Counseling and Wellness in Emporia, both of them covering a wide range of areas. Also, Vallejo in Topeka, Family Service and Guidance Center in Topeka, Stormont Vale Behavioral Health, all at a special website we have created for this project, WIBW.com/HearMeSeeMe. We are so grateful to all our guests today for getting the discussion started. This is a complex topic. It is one that we are going to continue to focus on throughout the year. We know this is a daily struggle, and we want you to know we hear you, we see you. Let's face this important issue together. Thanks.